limb runs from your deltoid to your hand, with 6 categories of muscles under your command. Throughout the pectoral region, shoulder and upper arm, your hand as well as the anterior and posterior forearm. There are 4 pectoral muscles on the anterior chest wall, with sternal and clavicular heads. Pec major is superficial. It serves to adduct your arm or bring it towards your core, and rotating your arm medially is its second chore. Under it, the minor forms part of the axilla's anterior wall, stabilizing the scapula and pulling it to the thoracic wall. Nearby, the serratus anterior pulls the scapula to the rib cage. It rotates the scapula, which gives your arm more range. The subclavius runs horizontally under the collarbone for anchoring and depressing the collarbone, it's known. The 5 extrinsic shoulder muscles go from the torso to the clavicle, scapula, humerus, and just so you know, the superficial ones are the trapezius and latissimus dorsi. The deep ones are the 2 rhomboids and levator scapulae. The 6 intrinsic shoulder muscles we will now discuss, running from the scapular clavicle to the humerus. The deltoid helps raise your arm, gives the shoulder joint stability. Teres major gives arm adduction, medial rotation. C. 4 rotator cuff muscles give the shoulder joint stability. Subscapularis and infraspinatus give humerus rotatability. Subscapularis rotates inward and infraspinatus outward. Teres minor helps the deltoid. Supraspinatus pulls upward. In the upper arm, 4 muscles are present, including 3 found in the anterior compartment: brachialis, coracobrachialis, and biceps brachii. And in the posterior compartment is triceps brachii, the anterior compartment of the forearm muscles, with superficial, intermediate, and deep muscles. And in general, these forearm muscles participate in flexing the wrist and fingers and making them pronate. Superficial ones arise from the medial epicondyle of the humerus, sharing a common tendon. They include flexor carpi ulnaris, as well as palmaris longus, and flexor carpi radialis. And last but not least, there's the pronator teres. The intermediate compartment has flexor digitorum superficialis, allowing these 4 fingers to flex just like this. At the wrist, 4 tendons result from splitting of this muscle, attaching to 4 fingers. After passing through the carpal tunnel, there are 3 deep compartment muscles: pronator quadratus, flexor pollicis longus, and flexor digitorum profundus. Posterior compartment muscles produce extension at the wrist and fingers, and have 2 layers to mention: deep and superficial, separated by connective tissue. There are 7 superficial and 5 deep muscles too. The extensor digitorum is the main finger extensor. The extensor carpi ulnaris is a wrist adductor and extensor. The extensor digiti minimi extends the pinky and wrist. Extensor carpi radialis longus and brevis help move the wrist.